Hello guys, today we will study about the bones of forearm and hand. Bones of forearm and hand. So the bones of forearm or and hand includes radius, ulna which are present in forearm, carpal, metacarpal and phalanges. These bones are present in hand. So we will go through about general bony features, site determination, muscular and ligamentous attachments, blood supply, ossification and clinical correlates. So first of all, bones of forearm and hand consist of radius and ulna, 8 carpal bones, 5 metacarpal bones and 14 phalanges. So first of all, we will go through the bones of forearm. The bones of forearm include radius and ulna. Radius bone is present laterally and ulna bone is present medially. So this is radius bone which is present laterally and ulna is present medially. Radius bone consists of a head, neck, radial tuberosity, ulnar notch and styloid process of radius. While the ulna consists of trochlear notch, coronoid process, a radial notch, head of ulna. And posteriorly we see that olecranon process is present in ulna and there is a styloid process of ulna. So we will go through these bones one by one. First of all, we will study about radius. Radius is a lateral bone of forearm. It is homologous with tibia of lower limb. Side determination. The upper end of radius is disc shaped and it is known as the head of radius. The lower end at the lower end there is styloid process present and at the lower end the interior surface of radius has a thick prominent ridge and the posterior surface has four grooves for extensor tendons and the medial border is the sharpest border. So we see that radius consists of a proximal end, shaft and a distal end. This is a proximal end, this is a shaft and a distal end. So in this diagram we can see that this is head of radius, this is neck of radius, radial tuberosity and this is the styloid process of radius. The head of radius, neck of radius, radial tuberosity and styloid process of radius. Now we go through the features of radius. Head is disc shaped and it is covered with hyaline cartilage. The upper surface of head is concave. The circumference of head is also articular and radial tuberosity lies just below the medial part of neck. And now we go through the upper end of radius. This is head of radius. Next to head, this is the neck of radius. This is radial tuberosity and this is shaft of radius. Shaft, it has a lateral convexity and it is triangular in cut section. There are three borders of the shaft of radius: interior border, posterior border, medial or interosseous border. There are three surfaces of shaft: interior surface which is present between the interior and interosseous border, posterior surface present between the posterior and interosseous border, and the lateral surface present between interior and posterior borders. The lower end is the widest part. The lateral surface is rough, projecting as styloid process. On the medial surface is the ulnar notch. On the posterior aspect of the distal end is a small tubercle known as the dorsal tubercle. And it consists of five surfaces. Interior surface, radial artery is palpated against it. Posterior surface present four grooves for extensor tendons and the medial surface has ulnar notch for the head of ulna. So in this diagram we can see this is a posterior view of distal end of radius. This is the groove for the extensor digitorum and extensor indicis muscle, and this groove is present for the extensor pollicis longus. The tubercle is known as the dorsal tubercle of radius, and this groove is present for the extensor carpi radialis longus and extensor carpi radialis brevis muscle, and this is the styloid process of radius bone. So we see that this is the inferior view of the distal end of ulna and radius. This is for articular disc, for leonate, which is a carpal bone, for scaphoid, this is also a carpal bone. So the features of radius is that lateral surface is prolonged downward to form slide process. The inferior surface bears triangular area for scaphoid and quadrangular area for the leonate. This surface take parts in the formation of wrist joint. So here we can see this is the inferior surface of radius. This is the slide process of radius, and this is the dorsal tubercle, and this surface is for the facet for scaphoid, and this surface is for the facet for leonate. Now we go through the attachments of radius. So in the interior aspect, first of all, we will see on number 6 there is attachment of bicep brachii. So bicep brachii attaches on the radial tuberosity. On number 7 here there is attachment of supinator muscle. Here there is attachment of pronator teres. On 12 there is attachment of brachioradialis. Here is an attachment of flexor pollicis longus. On 8th there is an attachment of flexor digitorum superficialis, and on 11 there is an attachment of pronator quadratus. So this is the attachment of radius bone. On the posterior aspect we can see here is an attachment of bicep, here is an attachment of supinator muscle, here is an attachment of abductor pollicis longus, here is an attachment of pronator teres, and here is an attachment of extensor pollicis brevis. So here we can see the insertion of bicep brachii muscle here, insertion of supinator muscle here, and insertion of pronator teres, and origin of the flexor digitorum superficialis. Here insertion of the pronator quadratus muscle is on radius is present here, and insertion of brachioradialis muscle is present here. And on posterior view we see that here is the insertion of bicep brachii muscle, here is an insertion of supinator muscle, here is an origin of abductor pollicis longus muscle, here is an insertion of pronator teres muscle, here is an origin of extensor pollicis brevis muscle. So this is a posterior view of the attachment of radius. So we can see the attachments: articular capsule of wrist joint, articular disc, interosseous membrane, oblique cord, and extensor retinaculum. On the blood supply, there are multiple metaphyseal nutrient phenomena that transmit branches of radial, ulnar, interior, and posterior interosseous arteries. And there are intercompartmental vessels send nutrient arteries to supply radius through the retinaculum. These vessels originate from radial artery and interior interosseous arteries respectively and anastomose with the dorsal carpal arch. There are three centers of ossification. Ossification center on the basis of quantity, primary 1, secondary 2 on the structure. Primary is present on shaft, upper and lower, and secondary appearance is at the 8th week of intrauterine life. Appearance upper 4th year and lower 1st year. And fusion primary never fuse, and secondary upper 18 year and lower 20 years. So this is the ossification at first year we can see at fourth and fifth year, at 18th year, and joint shafts at 17 to 19 years. Clinical anatomy is that their fractures known as Colles fractures, Smith fractures, and subluxation of radius. Colles fracture is that fracture of the distal end of radius resulting from a fall on outstretched hand and force drive distal fragment posteriorly and superiorly, and distal articular surface is inclined posteriorly. There is posterior displacement, provides a posterior bump. This is known as Diner Fogg deformity. Here in this diagram we can see fracture of the distal end of radius. This is known as Colles fracture. The second type of fracture is the Smith fracture. It occurs at the distal end of the radius, and it occurs from a fall on the back of the hand. And it is a reverse Colles fracture as distal fragment is displaced interiorly. And the third is known as the subluxation of the head of radius, called as the pulled elbow. It is caused by a sudden powerful jerk on the hand. The head of the radius is dislodged from the grip of the annular ligament. Now we will study about ulna. Ulna is the medial bone of the forearm. It is homologous with the fibula of the lower limb. Side determination: the upper end is a hook-like concavity directed forwards, and the lateral border is the sharpest and crest-like. At the lower end, the slide process lies posteromedially. Features of ulna: it has a hook-like concave proximal end. The shaft tapers progressively, and the distal end expands into a head and a styloid process. Now we study the features of ulna. The proximal end On the proximal end there is a olecranon process and coronoid process. The shaft and distal end. The upper end of ulna consists of two processes: olecranon process and coronoid process. Two notches: trochlear notch and radial notch. This is radial notch and supinator crust. So olecranon process, here we can see this is olecranon process. This is coronoid process. Ulnar tuberosity, and this is trochlear notch, radial notch, supinator crest, and shaft. Shaft consists of three borders and three surfaces. The first border is interosseous border, interior border, and posterior border. The surfaces are interior surface, medial surface, and posterior surface. The lower end consists of head and styloid process. The head articulates with the ulnar notch of the radius, and the styloid process projects downward from the posteromedial surface of lower end. So this is a diagram of ulna. We can see ulna here. This is olecranon, this is trochlear notch, coronoid process, tuberosity of ulna, shaft, and styloid process of ulna. Now we will go through about the attachment on ulna on the interior aspect. Here is an attachment of flexor digitorum superficialis. Here is an attachment of pronator teres. Here is an attachment of brachialis. Here is an attachment of supinator muscle. Here is an attachment of flexor digitorum profundus. And here is an attachment of pronator quadratus muscle. On the posterior aspect, here is an attachment of tricep and coneus muscle. And here is an aponeurosis of flexor and extensor carpi ulnaris. Here is an extensor pollicis longus. and here is an attachment of extensor indices. So in this diagram we can see there is an ascension of brachialis muscle on ulna here and origin of supinator muscle, origin of flexor digitorum superficialis muscle starts from here, origin of pronator teres and origin of flexor pollicis longus muscle, origin of the flexor digitorum profundus muscle, origin of pronator quadratus muscle. This is a posterior view. Here we can see there is an insertion of tricep brachii tendon here on olecranon process, origin of anconeus muscle, and origin of flexor carpi ulnaris, origin of extensor pollicis longus, origin of extensor pollicis in extensor indicis muscle, insertion of extensor carpi ulnaris muscle. So the other attachments are interosseous membrane, oblique cord, capsule of elbow joint, annular ligament, ulnar collateral ligament, and articular disc. On the blood supply, there are multiple metaphyseal nutrient foramina transmit branches of the radial, ulnar, interior, and posterior interosseous arteries. These vessels give off a number of smaller segmental branches, usually one but occasionally two. The major nutrient diphysal foramina are located on the interior surface of the bone, directed proximally toward the elbow. On the ossification, we see that there are two primary and two secondary centers structure. They're present on the shaft and most upper part and the superficial part of olecranon and lower end. They appear at the 8th week of intrauterine life. The upper appear the secondary ossification center. The upper appears at 10th year and the lower appear on the 5th year. And the primary nerve fuse and the secondary fuse at the 16th year and the lower fuse at the 18th year. So this is the diagram showing the ossification at the 5th and 6th year, 9th to 10th year, 16th year. So this is all about ulna. Please subscribe my channel and I hope so you will like my video. Thank you very much.